Hey everyone, I'm Dr. Sebastian Castelli, board-certified chiropractic neurologist with Castelli Chiropractic Center. So in our clinic, we often get asked questions about inversion tables. Do they work? How do they work? And do they help with the back pain? So the idea behind an inversion table is to stretch and elongate the spine and take pressure off our nerves. Our spine is made up of two components, bones and discs. Now the discs sit between the bones and act as shock absorbers. 1/3 the length of our spine is actually made up of those discs. So there was an astronaut who went into space for an entire year, and while he was in space, he had no pressure on his spine. A year in zero gravity. When he came back to Earth, he was actually almost an inch or two taller than when he had left. So that's because his discs were now hydrated with fluid that he didn't have before. It's pretty amazing to see what we can do when we take pressure off the spine. The concept of the inversion table is much the same. If we can alleviate some of that gravitational pull that we have on our spine, like 24 hours a day, or at least the hours that we're sitting or standing or weight bearing, we can alleviate some of the pressure. We usually don't have problems with inversion tables. The only danger is if someone gets stuck on it or gets stuck upside down, that can sometimes increase some of the symptoms. There are not a lot of dangers with inversion tables, but here's the thing, it's not very specific. It's a general stretch of the entire spine. If a patient is having a specific problem, let's say they have a herniated disc at like L4, L5, which are in the lower lumbar region, the lower back, we want to specifically treat that area. The only way to be specific with that would be with a decompression table. So we can program the decompression table, which is computerized, to that area and that disc herniation. So it stretches that specific area of the spine. It helps relieve the symptoms and may also help heal the condition. If you guys enjoyed this video, if you have used an inversion table or had decompression, I want to hear from you. So go ahead, comment below, and we'll talk soon.